In this video, we're going to explain what the black reference lines on the MyPeriopath report are, what they mean, and how they can be customized based on your practice's preferences. Reference lines, displayed as black lines on each bar graph, indicate the average bacterial level observed in patients with chronic periodontitis AAP stage 1 and 2. It's important to understand that these reference lines are not one-size-fits-all. While each patient's bacterial profile and inflammatory response is unique, the reference lines are a standardized benchmark established through periodic review of data collected from oral DNA testing and reflect average bacterial levels above which there is high confidence of a clinically significant periodontal infection. Next, we will review what reference lines are and are not. Reference lines are the average bacterial level above which bacteria tend to become pathogenic, a general indicator for remission of periodontal disease when bacterial levels are maintained below the reference lines, and a benchmark. If a patient has bacteria levels below the reference lines but has clinical signs of periodontal disease, this patient cannot be deemed as healthy due to the clinical signs. In these cases, additional risk factors may be contributing to their disease, and further testing might be needed to find the root cause. OralDNA offers a wide range of testing options that can be added within the 21-day sample viability window without the need to collect another sample. Reference lines are not a treat or do not treat threshold, a guaranteed trigger point for where bacteria will trigger periodontal disease. If a patient is below the reference lines but still has clinical signs of disease, this patient cannot be considered healthy due to the clinical signs, or an indicator of risk for oral systemic disease. Reference lines are optional and here for your consideration. The report is even customizable during the order process to include or exclude this section on the report. Once selected, the option to include or exclude can become your default for all future orders by selecting Yes on the Order Preference pop-up. This default can be changed at any time or customized for each order. If any of the bacteria reported are above the reference lines, and if you chose to include antibiotics on your report during the order process, antibiotic options will be printed on page 3 of the MyPeriopath report and customized based on the patient's bacterial profile. If bacteria levels are below the reference lines, or the selection to remove the antibiotics option is indicated during ordering, antibiotics will not be shown on the report. For additional antibiotic information and references, you can always access the MyPeriopath Antibiotic Options Guide in the Training Resources section of your OralDNA provider portal. If you have any additional questions or need personalized guidance, our Director of Clinical Education, Diane Larson, offers complimentary training sessions for you and your team. Complimentary sessions are always available to support your clinical practice and are for team member use only, not for patients. She's an incredible resource for answering clinical questions, reviewing result reports, and providing insights into challenging cases and treatment strategies. To schedule with her, click Request Consultation on your OralDNA portal dashboard.